So today I want to discuss the most effective herbal remedies that have been shown in research studies to help with erectile dysfunction or male impotence. There are several different causes of erectile dysfunction, and that's why for each of these herbs I'll mention for which erectile dysfunction these herbs have been shown to work the best. At the end of the video I will also mention several other helpful tips that make the herbs work even better. So let's start with a lesser known herb, and that's ashwagandha. Ashwagandha is a traditional herb used in Ayurvedic medicine. It is particularly known for its adaptogenic properties. What it means is that it helps the body resist physiological and psychological stress, which is one of the key aspects of erectile dysfunction, especially in younger individuals. Now, by lowering the stress hormones, particularly cortisol, ashwagandha may help to improve the overall health conditions that lead to erectile dysfunction. Now, some research also suggests that ashwagandha may increase testosterone level and improve male fertility. Now, since low testosterone levels can be associated with erectile dysfunction, the potential boost in testosterone might improve erectile function. Lastly, ashwagandha has also been shown to have a positive impact on cardiovascular health. Since heart health is directly related to sexual health, this could indirectly improve erectile dysfunction. While there is currently not direct scientific evidence that ashwagandha is effective on its own to treat erectile dysfunction, because of its overall health benefits, it is worth to include ashwagandha into the overall treatment approach as a baseline supportive treatment, along with one or two more specific herbs or supplements for a better result. The dosage of ashwagandha ranges between 1000 to 2000 milligrams 3 times a day after meals. Now, there are some side effects, and the most common ones include some digestive issues and lightheadedness in people with low blood pressure. It should also be avoided in individuals with autoimmune diseases, since ashwagandha is known to boost the immune system. So that would not be a good thing. So let's talk about ginseng now. Now, there are many forms of ginsengs. You have Korean ginseng, there is a Chinese or Brazilian ginsengs, and so on. Red ginseng has probably been studied the most and seems to be the most potent. It has been studied for erectile dysfunction of various causes, but the best results have been really achieved in erectile dysfunction in men with psychological causes, such as stress, anxiety, and so on. Now, the effective dosage is approximately 600 to 1000 milligrams taken 3 times daily for up to 12 weeks. Now, it is important to purchase a supplement that is standardized for the active ingredient, the ginsenoside. Avoid the over-the-counter ginseng candies or drinks or other things. Those are a waste of your money. Common side effects of ginseng may include insomnia, headaches, and gastrointestinal issues. So if you already suffer from, for example, insomnia, this is not the best herbs for you to take, since it will give you more energy and it can overstimulate your nervous system. In this case, it could also cause heart palpitations. In traditional cultures, ginseng has generally not been suggested for people who are younger than 40 years, because it is believed that if you are that young, you still have enough of the inner energy, so supplying something that will boost the energy even more can actually cause some significant side effects. So that's why in younger people, ginseng would not be probably the best option. Now, it is also worthwhile to know that ginseng can interact with some medication. In particular, it has been noted to interact with blood thinners and insulin, since ginseng has been shown to enhance their effectiveness. In this case, it is really best to avoid taking ginseng unless you can work with your healthcare provider who will monitor you more closely. The next herb that we will talk about is yohimbine. The primary component of this bark is derived from an African tree, and it has been shown to improve sexual dysfunction, which is associated with selective serotonin reuptake inhibitors, SSRIs, which are medications that are used to treat depression. These antidepressants have a very common detrimental effect on erection in men. So taking this herb can help to counteract these side effects. There is some indication from a small study that yohimbine may improve the effectiveness of the antidepressant medication as well. I'll leave the reference for that study in the description. Yohimbine also combines well with L-Arginine, which we will discuss next. In clinical trials, it was found that effective dosage for yohimbine is between 15 to 30 milligrams daily, divided into multiple doses. Now, since yohimbine can have side effects such as increased heart rate, high blood pressure, anxiety, and gastrointestinal distress, it is important to discuss with your healthcare provider that you would like to try yohimbine so that they can monitor you more closely, especially if you will use yohimbine to target erectile dysfunction due to the side effects of antidepressant medication. Now let's talk about L-Arginine, which is not an herb but an amino acid, which is important for blood flow. Some studies suggest that L-Arginine can benefit erectile dysfunction because it can improve vascular function and circulation into the penis, since erectile dysfunction is often due to a reduced blood flow to the penis. As I mentioned earlier, L-Arginine can be combined with other herbs such as yohimbine to improve their effectiveness for erectile dysfunction. However, studies have also shown the effectiveness of L-Arginine when it is combined with Cialis, which is a medication used to treat erectile dysfunction. When L-Arginine was combined with Cialis, the overall effectiveness for erectile dysfunction was better than when either one was used alone. Now, links to both studies are in the description. The effective dosage seems to be somewhere around 2.5 to 5 grams per day or as part of combination supplement. Some of the common side effects are nausea, cramps, and diarrhea. It is also important to note that L-Arginine should not be taken with Viagra or other blood pressure medication, and individuals with diabetes should monitor their blood sugar more closely if they start taking L-Arginine. Ginkgo biloba is another herb frequently used for erectile dysfunction. It has been mostly studied for erectile dysfunction, which is associated with the use of antidepressants, the same as with yohimbine, which we already discussed earlier. The way this is supposed to work is because the antidepressant medication, the SSRIs, work by increasing serotonin levels. However, the increased serotonin levels inhibit neurotransmitter dopamine and norepinephrine. Both of these neurotransmitters are necessary for sexual excitement. Ginkgo biloba might help alleviate this side effect by supporting neurotransmitter balance and potentially improving the sexual experience for those taking the antidepressants. Additionally, Ginkgo biloba is well known for its ability to improve blood circulation and contribute to better blood flow to the penis, which is crucial for achieving and maintaining erection. That's why Ginkgo biloba is particularly effective for erectile dysfunction, which is associated with vascular issues. Lastly, some sources suggest that ginkgo can help reduce anxiety, which can be a contributing factor to erectile dysfunction. So, if part of the sexual dysfunction is anxiety related, reducing the anxiety could potentially improve sexual function. Now, the effective dosage ranges from 60 to 240 milligrams a day, taken usually in divided doses. Some studies suggest that it works best if it is taken before sexual activity. Some common side effects include an increased risk of bleeding, which is particularly important to discuss with a healthcare provider if you are taking blood thinners. In general, it is best to avoid taking ginkgo if you are taking blood thinners like warfarin or other antiplatelet drugs. Horny goatweed is another herb used for erectile dysfunction. It contains active compound called icarin, which has demonstrated properties similar to those of 5-DE5 inhibitors, which is a class of medication including Viagra and Cialis, which are commonly prescribed for erectile dysfunction. Unfortunately, there is no clinically based recommended dosage due to the limited human studies. Horny goatweed is available in tablets and capsules with the usual dosage of 250 to 500 mg capsule or tablet, and the usual dose is 1 tablet or capsule daily. Some of the common side effects include dizziness, dry mouth, and upset stomach. Now, it is important to know that horny goat may interfere with heart or breathing medication due to the potential for increasing heart rate and altering blood pressure. This would be probably the last herb that I would try due to the mixed results in studies, but I listed it here just for completeness. While all of the above herbs may help with erectile dysfunction, it is important to keep in mind that erectile dysfunction is not just an inevitable aspect of aging, the so-called natural progression that man should possibly accept. Now, adopting this perspective can be potentially very harmful since it dismisses the fact that erectile dysfunction is a possible indicator of severe underlying health condition such as heart disease or diabetes, meaning if there is poor circulation to the penis because of blood vessels are blocked, the same is most likely happening in the heart. Therefore, I strongly suggest anybody with erectile dysfunction to seek medical evaluation before starting with any of the above herbs and supplements to make sure that these serious medical conditions get ruled out first. Now, avoiding alcohol, following a healthy diet, and engaging in regular exercise will further improve the effectiveness of any of the above herbs and supplements. In fact, regular exercise is probably the best way to improve sex drive. And that's all for today. I will see you in the next video.